Yo, welcome people, this is Jonte aka Jeantavius. This video took a long time to clear, but I have finally been able to put it together, so thank you guys for all your patience. You guys taken a lot of note taking, done my experiences and everything. I've had a lot to go through and a lot of editing and a lot of piecing together. You guys enjoyed the video, it's a bit long, so pay attention or else this motherfucker's gonna be at your window tonight. He's gonna fuck me up when he sees this. I have cited the websites that I've used for this information in the description. If you need any more information, do go ahead and check that out and have a look through the websites because they are really helpful and they're really resourceful. Anyway, that's enough from me. You guys enjoy the video. Alright, so on the 24th of August 2022, I had my first consultation at St. Bartholomew's Hospital, a fertility clinic, and on the 14th of February 2023, I had my eggs frozen and collected. This is me going over everything that happened in between. This all started in my second assessment appointment with the GIC, where we had gone over my life story, my history, and just my social aspects of the transition, doing everything in preparation of me actually starting the transition process. One of the things that came up was egg freezing, fertility preservation, the possibility of having children in the future. At the time, I wasn't really thinking too much about having children because I was that eager to get on T. Obviously, after some convincing and some conversation, the clinician that I'd spoken to had convinced me to freeze my eggs, and honestly it was probably one of the best decisions I've made, simply because I now have the option to have children if I want to. Even if I don't want to use them, I still have my options more open. I think it's really important for people to think about these things before transitioning because it is a very lengthy process. You're going through a lot of changes. Now, as you very well know, this video has been in the making for a while. I've been battling with my ADHD for a bit. I've been taking notes on my phone, I've been taking notes in the notebook, like everything's a bit of a mess. This is what worked for me, so it is what it is. Alright, so first off, what is egg freezing? According to the HFEA, egg freezing, which is a form of IVF treatment, it is a method of preserving fertility for anyone for any sort of reason. So it could be cancer, it could be terminal illness, it could be a form of infertility in cis people. It's also a way for trans people to preserve their fertility before starting hormone treatment, to give them the option to have their own biological children. For this process, they use hormones such as FSH. They use this hormone to boost egg production and fertility and maturity. During this process, you will also be tested for different types of diseases, anything that could affect the treatment. If you have a certain kind of disease that could be dangerous or something like that, they'll be able to store them in a different section. Personally, I had to go for a lot of ultrasound scans and blood tests to make sure I didn't have certain diseases and to make sure that they could monitor what was going on. And it was really important for me to track my menstrual cycles at the time, just so that they have an understanding. I shouldn't have to explain it, you already know. You'll be put on a certain hormone cycle for a certain amount of time. You have to do injections in the morning and night while doing scans at the same time so that they can track the progress. After everything is done, you'll be taking the trigger shot. They will collect the eggs under anesthesia and then freeze them, and after that you should be done with the process fully. The only thing to worry about after that would be the financial aspect, paying for the eggs to be kept frozen, further tests, the post-quarantine tests. In my case, it was the karyotype and cystic fibrosis test, which came back normal. That's pretty good to hear. Alright, so why is fertility important? I'm going to be reading off of this, by the way. I'm not even going to act like I rehearsed all of this because I did not. Literally just wrote it down so that I didn't spend 45 minutes trying to start through all of the other things going on in my head. Right, so the medical treatments for gender dysphoria, hormones or surgery can have an impact on fertility. It is very important to think these things through and understand your options so that you can make an informed decision. So make sure that you know what you're getting yourself into. Hormones will have a negative effect on your fertility. Like I said before, it's good to have the option to have your own biological children, and obviously there's plenty of other ways to have children, like adopted. Whatever works for you honestly is completely fine. I would say that I'm blessed to have a psychologist who works in the medical field. She was able to give me some really good insight in all of this. With both her and the clinician giving me advice on these types of things, it was really eye-opening for me because I didn't really think about my future, especially in regards to children. I'm 21 right now, so I'm not really going to be thinking about having children anytime soon, but I don't know how I'm going to feel later on in life, so I think having the option is really good. Now I know I can have my own biological children. I was able to get that out of the way before I started hormones, so it was really efficient in that way. Fertility may not be on your mind when experiencing gender dysphoria and you may be eager to start treatment. However, it may become a source of regret when it becomes harder or impossible to have a biological family. So I leave that with you guys. Obviously, if you want to consider that, definitely go for it, but if not, all power to you. How does it work? After my second assessment, I had spoken with my GP and was referred to a fertility clinic where I had my consultation appointment, which was the 24th of August that I said before. During this consultation, they explained everything to me, going over their risks and the funding process, and they also told me about all the services that they had that I could use if I needed any help or anything. They had things like finance, counselling, admin, nurses, embryologists, anyone that you need to get in contact with during this whole process they had on email. After getting approved for funding from my ICB, I had to do regular blood tests and ultrasound scans. So before I started the actual process after the consultation appointment, I had to get a proof of funding for my ICB because the shit was expensive. I have cited all the websites that I've got this information from. I've left them in the description, so definitely go ahead and check that out. The HFEA website has a lot of information regarding this topic. It goes over all the questions that you might have, and if you have further questions, I believe you can get in contact with them. The nurses had recommended me have a look through some of the websites to make sure that I know what's going on and that I'm well informed. After getting a proof of funding, I was then booked in for an information session and a virology session. This is where they explain all the hormones that I'll be taking, the intricate details, the risks, and what I do in certain situations. And then there was a virology screening to make sure that I didn't have anything dangerous in my system, which I didn't have, so I'm grateful for that. And before I started all of this now, there was a number, and I mean a number, of e-consent forms that I had to fill out. On that day, they gave me my password and everything for the forms and that, and I went and collected the prescription, which contained all of the hormones and stuff that I would use in this process. It's finally left the hospital, innit? Tell me why this man gave me so much. These man gave me so many drugs, cuz it's a fucking McDonald's takeaway bag type of thing, fam. Look at this bumper. Here is the bag that I got the prescriptions in. I didn't end up using all of it. I've just kept everything in the same place. I don't know what to do with the rest of it. The e-consent forms covered a wide range of potential scenarios in regards to the use of my frozen and stored gametes, eggs, whatever, which would include death, mental incapacity, donation, and research. Going through these forms allowed me to understand and manage what would happen to my gametes if any of these situations were to occur. So this would include whether you'd want them to be used for training purposes, or in a case of like death or mental incapacity, there could be a scenario where you allow your partner to use the eggs, do IVF and have a child. And then there's obviously the case where you could donate them. In the case that I would allow them to be donated and used for someone else to create a family, I had to write down a couple of things about myself in case the child wanted to know a bit more about their donor. This was a very difficult form to fill out because it's like you're not really thinking as much about what your kid is gonna want to know about you, especially at the age of 21. I just wrote down things like my hobbies, things about myself, the way I look, and I wrote like a little message. I'm not gonna say exactly what it was. It was very difficult because it was a very new perspective to take on. At this age, I'm not really thinking of parenting a child. If that does happen, they want to reach out, then you know, there's that. So now I'm gonna get into the actual process and what I had to do. I'm just gonna go over the prescription that I picked up for this, and I believe I showed this off in one of my first couple videos. So I'm gonna go over the medication as I tell the story. After the information session, I had started this medication, which is Provera. At the same time, I had to track the menstrual cycle so that I'd know where I was. I'd let them know whenever I started and whenever I stopped. I feel like I'm forgetting information here. I used 3 different methods to sort of take down notes for this. You can see how sporadic my thought process is sometimes, but you know, whatever works, innit? Right, so I had notified the clinic when I got my next period, which was on the 30th of December, and from day 21 of my cycle, which was on the 19th of January, I had started taking the Provera medication. I took 10 milligrams, 2 tablets daily, 1 in the morning, 1 in the evening, and while I was on this medication, they did not expect me to have any sort of bleeding, so I didn't bleed at all. A baseline scan was booked on the 24th of January, where they just figure out where I'm at. This is our starting point, basically. During this appointment, a nurse would advise me on when to stop the Provera medication and to notify the clinic when I started bleeding again. So as advised to stop on the 27th of January, and I had started bleeding again on the 29th, which was literally 2 days afterwards. That's when I started the Gonal F injections.
With great power comes no responsibility.
Absolutely none, no.
Let me, I'm gonna call you. Don't forget about me. And I'm gonna call you like, I don't know. I'm gonna finish the song. I'm gonna talk to this finish making the song, and I'm gonna call you.
By the time you call me, I might be done with the injection, innit? If I can wait, I'll be real, I don't mind.
Yeah, no, don't wait. Because if I see you inject yourself, I'm just gonna spin the block and punch you directly in the place you inject.
Wait! This is the first day of injection, so man's ready. Got my Deadpool socks on. I got my dinosaur plaster. Time for me to stab myself. Got my little Gonal F. I feel like I'm opening an iPhone, bro. Where's the instructions? I need that shit. Alright. Dose is 112.5. So I was to take this every evening from the 30th of January. Now in this box you get a little pen, and then you get one of these little needles, and then you'd attach it to the sort of screw it in. This bit would be full up with liquid, and what you do, you turn the dial up. If you can let me drop this up, hopefully it can focus, and then you turn up the dial, and I believe I'd use 112.5, and I inject it into my abdominal area. Now I did document this, so you'll be able to see it already anyway. So Gonal F, I started that on the 30th every evening, and then from day 6 of the bleed, which would have been on the 3rd of February 2023, I started the Thiamidol injections. These are pre-filled syringes, and I would add this to my routine to do every morning. At 7 AM I was doing the Thiamidol injection, at 7 PM I was doing the gonal F injections, and I was continuing this for a while. So I'm done with the injection. Usually I just do this and then put it in the shot spin. I had blood and urine tests regularly booked in for me to do, and additional scans for them to monitor the growth of the eggs. Every scan they do, they'd go in and check the follicle length. Since my scans were trans-abdominal, I had to go in with a full bladder every time. During that time, I had to drink a lot of water. They told me to drink around 2 to 3 liters a day. And even now, after the process, I'll still be doing that. I've got my bottle right here. Just about almost gotten through it. It's around 1 AM now, so I've probably already failed, but it's the effort that counts, and I'm still gonna refill it tomorrow. I had a lot of physical restrictions for work because I do warehouse work. I had to let my bosses know, and my managers know, supervisors know, so that they could impose restrictions to make sure that this didn't affect anything for the treatment. I asked my nurses to give me a little bit of a rundown via email to make sure that it was official. Now, I'd gone through this entire process of taking injections for a while, and honestly the process was long as fuck, long as hell. The side effects, I've been having some headaches, some stomach aches, I had cramping, not too much cramping, it's just very slight cramping. I've been feeling pretty bloated, but it could be because I've been drinking 2 to 3 liters of water a day, which I have to do according to the nurse. Over time, I felt really bloated, I felt really lazy, I felt kind of like shit, really. It was just very, very long. Since the eggs grew to a considerable size, it felt really weird to move around. It was like having period cramps. It's like I needed to shit. I was not comfortable, it was not nice. I didn't last too long. Just leaving the hospital now. I've had my last scan appointment. They said after this I'll be having the egg collection, so I should be over and done with this very soon. For the whole day beforehand, I can't eat anything, so I'm going to be struggling with them. I had appointments booked Friday the 3rd, Monday the 6th, and Wednesday the 8th of February. During that last appointment, I had my collection booked for the 14th of February. So my last gonal injection was the 11th of February on the Saturday, and the last Thiamidol injection was the Sunday the 12th of February. And I had my trigger injection. It was buserelin, and I did this at 8:30 PM. The buserelin injection was a bit different because most of these were pre-filled syringes, like the gonal F was like an injection pen. Thiamidol was pre-filled. Buserelin, I had to actually extract the liquid myself. During the Monday, I didn't have any injections. I was also told not to eat anything one day before the surgery, which was literally torture. Even pre-T, I had a relatively decent appetite. Even at work, I wasn't doing too much, but I was doing enough to where, you know, you want to eat. Even nowadays, I snack a lot at work. So spending a whole day not eating anything, just drinking water, because that's all I could do. I could only drink water. I was a bit moody because I was angry and because I was very hormonal. So I had the retrieval surgery on the 14th, arriving at the hospital at around 7:30 AM. Now, I did make a little segment on this before I started to eat again, so you're going to see a considerable difference between that video and this video. Alright, cool. Today, it's egg retrieval day. I'm going to be having the surgery in more than an hour or so. The day before the surgery, you can't eat anything, so I've been losing my mind. Yeah, hopefully everything goes well. In the usual circumstances, I would have started testosterone immediately, but when you take the time to research and look at your options, it's better that you actually think about if you want to have children in the future. Doing this beforehand gives me the opportunity to have the kids in the future instead of just later on coming off of hormones and going through this entire process again. Packed a couple things in my bag, like snacks for afterwards, water bottle, dressing gown, extra underwear, sanitary pads and that, football charger. And I also had to bring a wallet with me, my ID, because they will do that before you actually start. I don't really think I have much to say. I'm not really too good at the commentary tip. Yeah, that's what's going on right now. I ain't got no trim. You can't use lotion or nothing like that, so I'm feeling dry as shit right now. So what? It is what it is. A few things I wanted to note down. I've never had any sort of surgical experience. This was relatively new to me. I couldn't wear a binder at all, so I was really nervous about what clothes I could wear. Temperature was relatively low because it was still pretty early in the year. I was able to layer up a little bit, so I wore a kind of oversized oversized jumper that was coloured black. I wore a big puffer jacket and some joggers and some socks. Obviously, I didn't know what state I'd be in after surgery, but I had to make sure that I wore something that was relatively easy to take off and put back on. Terrible posture the entire day. It wasn't really too much of an issue for me, but yeah, I just recommend trying to wear oversized clothes to try and help, you know, ease the dysphoria. Two things that were mentioned: patients are not to be left alone for 24 hours after collection. Please make sure you have someone with you and someone to take care of you when you get back home. It's very important to try and find people that are going to support and help you during this time, because it's going to be a little bit difficult. This will also show you who will be in your corner when it comes to other parts of your transition, like your top surgery. It's really important to know that you have some people that you can trust, especially in situations like this when you're really vulnerable. On the surgery day, we arrived, everything went relatively smoothly. I had then gone into another room where they put my wristband on. My dad was there and we were asked about like medical history, anything in the family that could be potentially dangerous. Everything was relatively alright. After that, I was escorted to the outpatients room. We were all separated by like big curtains. They gave me my gown and my socks to change into, my little lunch lady bonnet. One by one, they introduced me to a few different people at times. So they had my surgeon come in and I signed a couple forms to make sure that I understood what was going on. I don't know how much information I can give out, but again, I have put websites in the description to make sure that you guys know. So please do pay attention, make sure that you do your research. So after I had signed those consent forms, I had been introduced to a couple other nurses at a time. Eventually I was taken to the operating theatre where they set up everything and I got to meet the team, and everyone was really nice, really friendly, really respectful, especially in an institution that works with mainly women. They were really respectful. It's like they already knew how to treat trans people. There was no real slip-ups or anything with the pronouns. Relatively fine. It wasn't really that important to me, pronouns. I just wanted to get this over and done with. I doubt that they will be seeing this, but if the team ever does see this, thank you guys so much for giving me such a good experience. Honestly, I've never felt more safe and more, you know, cared for. They catered to everything I needed. After being introduced to the team, I did a few more things to prepare. It was a bit uncomfortable. Times like that where I'm glad that I have the mental fortitude that I have, because I was feeling really dysphoric and I was feeling really uncomfortable, especially since, you know, I was in an unfamiliar place, in an unfamiliar position. But again, the nursing team, the entire surgical team did an amazing job making me feel safe and catered to. The anesthesiologist, we had a nice little conversation as, you know, they were putting in the IV tube. You might be able to see, if the camera wants to focus, where the IV tube went in. There's a little scar there, you can see where the vein is. We were having conversations about dinosaurs or something like that. He put in the IV tube and then I could literally feel the medication getting injected into my arm, like it was a cold rush up my arm, and I could feel it go through the vein. That's when I started to feel a bit off. It was a really lovely feeling. I'd do it again if I could, but obviously I'm not a crack addict. I must have felt drowsy at some point. I got a mask put on my face. Someone took off my glasses. After my glasses were taken off, that's when I sort of like clocked out. Next thing I knew, I was waking up in the outpatients room. It felt strangely normal. I wasn't really feeling nauseous per se. I was just feeling like I took a long ass nap and I just woke up, and the only thing I really would have felt was some slight discomfort in my downstairs region. Obviously because they've been going in and extracting the eggs one by one. It took me a little while to recuperate. A nurse came in and she checked on how I was doing. You know, she asked me if I was hungry. After that day of not eating food, I was incredibly hungry. I was eating hella biscuits, drinking a lot of tea. I was just on my phone. I was just chilling, eating food. It was a nice little relaxing process. I wouldn't have thought that I had surgery. After a certain amount of time, a nurse came in and started escorting me to the bathroom. So I'd go in and use the bathroom and she'd do a check to make sure that everything is going well. If there's any bleeding or anything, that it'd be catered to. We've done this around 2 to 3 times. Unfortunately for me, I was bleeding a lot. I had to go back into the operating theatre and they had to stop the bleeding manually, which was hella uncomfortable. I filmed it. I'm not gonna explain how, but I filmed it. After that, I had a nice little conversation with my nurse. I was escorted to the waiting area where my parents were. They did wait the entire time, so I'm really grateful to have them. It was really nice to see, regardless of what our views may be, they were able to come with me and support me. So we'd gone home. I'd taken around 2 weeks off of work. At the end of it all, I managed to get 12 eggs. A good amount. I'm happy with it. I'm happy with the process, and I'm happy that I've gone through that now. I have 12 chances of having children. During the recovery period, I was just chilling in bed, watching anime, playing games and shit. A couple of things that happened after surgery. I struggled to shit. It did subside after some time, because obviously everyone needs to shit. This was one of the most uncomfortable feelings I've had in a while, and there was that on top of the cramping and pain that I had. I was prescribed doxycycline. It was a sort of antibiotic to make sure that there'd be no infection. 6 months afterwards, during around mid-August, I had the blood collected for the karyotype cystic fibrosis test. I had to pay for these, which was 970 £8. Overall, the experience was something. It was an experience, let's say that. Obviously, I had my moments of feeling dysphoria. Thankfully, I do work out, and I brought my body to a point where I didn't feel as dysphoric as I could have felt. Obviously, I got to show appreciation to the boys that made sure that we were clued up on everything. Now, what are the risks when it comes to this actual process? Ovarian hyperstimulation syndrome. The possible side effect from injecting FSH, follicle stimulating hormone, if you didn't pay attention in science, is a reaction that causes the ovaries to produce a large amount of follicles, which can enlarge the ovaries, causing them to release chemicals into the blood vessels. This can also happen after 2 weeks after the egg collection, so it is important to be cautious. There are mild, moderate and severe symptoms when it comes to these cases. Usually if this case was to happen, you'd have to go to A&E and they'd have to drain you of the fluids in some way, shape or form. To go over the symptoms, so we've got the mild symptoms, we've got abdominal swelling, feeling bloated, nausea, heartburn, indigestion. Moderate symptoms would include fluid building up in the abdomen, which obviously causes increased abdominal pain and vomiting. And now we have severe OHSS. This would only occur in 1 to 1.5% of patients. Thankfully, it's a very low percentage. Characterized by nausea, vomiting, ovarian enlargement, and ascites, which could prevent proper movement of the diaphragm. So there's a bit more, but I won't get into it now. Definitely go ahead and check out the website. Now, what are the costs? I can't speak for US citizens. I could try and find a video that goes over the US process. In regards to the costs in the UK, these can vary based on what hospital you go to. Having them collected and frozen can be up to £3,350. Medication itself can be from around £500 to £1,500. Storage costs could be around £125 to £350 per year. Mine is free for the first 5 years. After that 5 years, I have to pay £300 every year to keep them frozen. I can keep mine frozen for up to 55 years, which is nice because I don't know how I'm going to feel in the future, and I have plenty of time from the age of 21 to decide whether or not I want to have these kids. Storing a process and the womb transfer can be up to £2,500. Now in this, the total cost can come around to £7,000 to £8,000. Do make sure you get a full cost of treatment plan so that you're not surprised by any unexpected costs. It's also the case of finance when it comes to NHS. If your clinic has a funding department, definitely ask questions, because you want to make sure that you are clued up on everything and that you know what's going on. Ask how you can check with your ICB if they provide funding for your process. Make sure you use the departments and the services that they provide in the clinic. They have dealt with a wide range of people who are in a wide range of situations. Better to at least try to make sure that your situation is known, whatever situation you're in, so that they can cater to you. Everything went relatively smoothly as it could have gone. That was a lot to process mentally and physically. So yeah, that basically summarizes my experience in the egg freezing process. Now I am around 7 months on T, and I'm still feeling happy that I did it. I couldn't be more grateful for the people around me, my friends, family who supported me during this time. Like, thank you so much. A real special shout out to the nurses and the doctors who catered to me. It didn't really feel like I was just another patient. It was nice to talk to them about my experience as a trans person. They were asking a few questions in regards to how, you know, we'd want to be treated. It was really nice to see this sort of progressive attitude from people. You never know what kind of person you'll be dealing with, especially when working in the medical field. It's important to understand how to respect someone and, you know, what boundaries to put in place. But yeah, that should be it. The next video that you'll see from me will probably be my 8-month update video, 7 and 8 month update. I hope this video is useful to someone who is still contemplating what to do before they start their testosterone. I think it is possible to start afterwards, but it's up to you. I will see you guys in the next update when I hit 8 months on T. Thank you guys so much for watching. Take care and peace.